You ever said, ouch, my aching back? Well, yeah, many of us do have one, or pains in our necks, and we seek relief in various ways. Could be a massage, maybe an anti-inflammatory, or it could be in the form of a chiropractor. But many people are sort of split on the issue as to whether or not they're effective or whether or not they're the right thing for you. So to describe his profession and tell us what happens when we go in for chiropractic treatment is Dr. Mehmet Ozman. He joins us now with more. Hi, Dr. Kent, and welcome to our program, Ebru Today.
It's good to be back. I've been on Ebru back in '07, twice on the then morning show, and they did a 60-minute segment on me as well. It's a wonderful show you have here. Welcome to America, Canada, Africa, and now Europe. Oh my goodness, you guys are getting really big.
All around the world. So Dr. Kent, for people who don't know, tell us what you do. You're a chiropractor.
I'm a chiropractor, and I've been doing it for 18 years. Basically, chiropractic is about 4 statements, and 2 of them are about the same. One is that the body should help itself, run itself, heal itself. Yes, we all know that. Number 2, the medical model for 150 years has said there's 11 systems in the body, like digestive, respiratory, circulatory, muscular, nervous, but it says for 150 years in Gray's Anatomy that the nervous system, or the electrical system, is the one that masters all the other systems.
Sort of in charge.
In charge. So in 1895, 118 years ago this month, chiropractic said, well, if the nerves are the ones that are masters of all the others, let's look there first.
Okay.
Kind of like if you have a washing machine or a computer problem, you call technical support. What's the first thing they ask you? Have you got it plugged in?
Right.
You think,
sure.
oh, well, why do they ask that? So,
Sure.
because some people don't. So for the electrical system, we're looking to make sure everything's plugged in. Does it flow or doesn't it flow? If it's not flowing as well to some section, that section's not going to work as well.
Okay, so is that how it then differs from the quote-unquote regular medical model, chiropractic medicine, as opposed to what we normally considered, you know, what you would just do if you were going to your regular internist?
Well, if you want to consider a model, dental model is probably closer to chiropractic.
Okay.
You don't say, I'll only go to the dentist when my teeth hurt.
No.
You go to get checkups to catch things that
Preventative.
you don't know you've got.
Sure.
Because if you feel a cavity, it's a little too late. If you feel a subluxation or a nerve not getting through, it gets to be a little too late.
Okay, so that's sort of the whole idea of actually going in for wellness treatment, not just going in when you have a pain in your neck or a pain in your back. And talk to me about the different things that people can do and what they should expect if they go in and they're seeking wellness.
Well, very good question, and here's the point. This is an art as well as a science. So no 2 chiropractors are going to be exactly the same. Just like if I gave 2 people a brush and a canvas, the picture's going to be different.
I like
so there's
watercolors,
200 styles of chiropractic as well.
Okay.
Completely different styles. Some that are hard, some that are as soft as a touch, some that use an electrical gun, all sorts of different styles.
How do you determine which one you might be best suited for? What kind of personality you have, or what kind of body type you have, or what your affliction is? How would you know?
That is an excellent question. I don't have a great answer for that one.
I ask the tough questions here on Ebru Today.
Just like getting your car fixed, what do? You ask your friends, who does your car? How well does he do it? So probably word of mouth and referrals might be easier, and I would suggest for people to interview and try a couple of chiropractors.
Gotcha. You brought a little friend along. Do we get a chance to check him out?
Well, I call him Calcium, from a doctor friend of mine who named hers that.
Okay.
So, but the point of
I get it now. Sorry, don't. It took me a minute.
But the point of this is that the nervous system comes from above downwards and from the inside out.
Okay.
And when we adjust for the subluxations or the interferences to the nervous system, we're trying to get the body to heal above, down, and inside out.
Okay.
For example, somebody might have a low back pain down here.
I got one of those.
Okay. Might have a low back pain, but if you went to the hospital, they're going to look here, x-ray here, MRI here, shots here, PT here. Chiropractic says, well, okay, there may be a problem here, but maybe there's something blocked further up.
Oh.
Many a times I find something in the neck not getting through, so it's keeping this weak. Similar to a light bulb being off. If you said, hey, fix the light bulb,
Sure.
What's the first thing you'd say? Check the
Right,
switch.
check the switch. Like you said, is it plugged in? Yeah, the knee bone is connected to the thigh bone. The hip bone could be connected to the neck bone.
Right.
So is there anybody for whom this is more suited? You know, can kids do it, adults, people that have had injuries? Is it?
Well, let's go back to medical model.
Okay.
Would you say I'll take my child to the dentist as soon as he turns 21.
No,
No,
I
no.
hope not. That would be bad.
Chiropractic pediatrics is a big field. And people who say, well, does that baby have low back pain? I say to them, did you forget this?
Yeah.
Okay, or learning how to walk, step, 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 boom.
Gotcha.
And if the sacrum gets off, guess what? A scoliosis could start.
Right.
So for children, it's preventative. For adults, it's more fix it.
All right, that's good to know. We can fix it and we can prevent it. Thank you, Dr. Kent, for joining us on Ebru today. I love the display here. I like the show and tell.
And next time, we're going to show and demonstrate how we do these things.
Okay, yes. I don't know if I'm going to be the guinea pig that time, but, you know, we'll find another one.
Very good.
Thanks, Dr. Kent.